The Domino service is a midwifery-led service that has been up and running in the University Hospital Waterford for many years. We are a team of 5 midwives and we look after women who have low-risk pregnancies. Our aim is to work in partnership with you and your family to promote a healthy-based approach to your pregnancy. We look after you throughout your pregnancy from the booking visit at 12 weeks right up until 5 days after your baby is born. We provide antenatal care both in hospital and in 2 outreach clinics in the city. Because we are a small team, you will get to know the midwives providing your care. Our appointments are flexible and can be made to work around you and your family. Each appointment is roughly 30 minutes long with a minimum waiting time. We also look after you during your labour, whether it's in the hospital or in the home for a planned home birth. And we can provide an early discharge home service which provides postnatal care in the comfort of your own home. Should your pregnancy become higher risk at any stage, we can refer you onto our obstetric team in the hospital. We look forward to welcoming you into our care.
Hello, my name is Grace Welch, and as part of my midwifery role, I provide postnatal care at home to new mums and babies within the Waterford City area who have been discharged home within 72 hours after birth. I bridge the gap between hospital and community with follow-up care at home. During these home visits, I do a full postnatal check-up on mum and baby. The postnatal check can include a review of the wound sites and dressings and provide parent craft education to new parents. I also perform a checkup on the baby. I assist with breastfeeding and infant feeding, ensuring your baby is feeding well and gaining adequate weight. I also carry out the blood spot screening test or the HEAL test and observe the baby's general well-being, making referrals to the appropriate wider multidisciplinary teams where necessary. I work closely with all other disciplines such as public health nurses within the area, lactation consultants, perinatal mental health, GPs and the paediatric assessment unit here in the hospital. Working together, the overall aim is to provide optimal postnatal care support and advice for new parents on their journey into parenthood. Another part of my role as outreach coordinator is to coordinate the Waterford Postnatal Hub at the Brill Family Resource Centre here in the city. The hub runs every Wednesday from 9 a.m. to 12 midday and is open to all new parents from Waterford City and wider areas. It is facilitated by many healthcare professionals to provide the best ongoing postnatal support and advice in the community for 6 to 8 weeks after the birth. At the Postnatal Hub, our aim is to have a sociable place for new parents to meet and share common experiences, feelings and knowledge. Our hub team will be on hand to provide advice, support and guidance in the first few weeks. Parents also have the opportunity to meet us on a one-to-one basis if preferred and/or participate in open conversations. Parents are welcome to become involved in our health promotion and wellbeing information sharing sessions. We look forward to meeting you and your new baby there. Thank you.
Hi, my name is Victoria Byrne. I am the Advanced Midwife Practitioner here in UHW. I specialise in midwifery care in the Supported Care Pathway Service. I promote wellness, offer healthcare interventions and advocate healthy lifestyle choices for women, their families and the community. I work at a high level independently in advanced practice, but also collaborate with the multidisciplinary team for complex women wanting midwifery-led care and domino-led care. The overall purpose of the service is to provide safe, evidence-based, shared decision-making. A new postnatal hub has been set up in the community and all women are welcome to attend. If a client would like to debrief or discuss their birth, I can offer a service at the hub in a safe environment away from the hospital if the client wishes this. As a midwife, I help the women identify problems, if any, and give them the information, options, and the authority they need to make their own choices.
Hi, my name is Breed. I'm a part of a team of midwives who offer continuity of care to low-risk women under the Integrated Hospital Community Midwifery Service. We looked after you and your family from your booking appointment right through your pregnancy, labour and after your baby is born, up to 5 days postnatally. We provide women-centred, individualised care in a holistic manner, offering the support and knowledge to help you make informed choices, to help maintain a healthy pregnancy and empower you to give birth the way you want. We promote normality and natural active childbirth in the setting of your choice. We provide hospital-based antenatal clinics and outreach clinics in the community. We offer a choice of birth settings: home birth alongside midwifery unit where the pool is available for water immersion and birth, and the delivery suite. We offer early discharge 6 to 12 hours post-birth and home visits to support your postnatal journey. You can self-refer by phone or email. Your GP can send a referral, or you can transfer from the outpatients clinic to us. You can contact us on phone 051 842045 or email uhwdomino@hse.ie.
Hi, my name is Brie Galvin. I am the high-risk pregnancy midwife here in UHW. My role is to provide support to women who present with pre-existing medical conditions in pregnancy. For example, if a woman presents at booking with a history of epilepsy, or if you develop complications during your pregnancy. I provide the midwifery link to women that may require additional specialised obstetric care. Women who have had one previous caesarean section can avail of the Birth After Caesarean Clinic. This clinic provides women with the opportunity to obtain evidence-based information to make an informed choice on their mode of delivery. I work within the multidisciplinary team to ensure that you are provided with safe and high-quality care throughout your pregnancy and birth.
Hi, my name is Anne-Marie and I'm one of the midwives working here in outpatients. Here in University Hospital Waterford, we provide a choice of antenatal education options for parents and caregivers, both online options and face-to-face. So there are 2 locations for our face-to-face classes: Carrickferrish Library and also the Brill Family Resource Centre in Ballybeg. There is a choice of dates and times which can all be booked by your midwife in our office in outpatients. And alternatively, if you prefer the online option, you can pick up a QR code in our reception area in outpatients. You scan the date that suits you and your partner to attend. All of the classes that we provide are parent-led, which means the content is determined by the parents and what they would like to know. I aim to keep all of our classes small and casual, so there's lots of opportunities for questions. In particular, I hope the face-to-face classes will give parents a really good opportunity to meet other parents in the community and hopefully to start to build relationships with these other families. Thank you, and I look forward to meeting you all.
Hi, my name is Mary Frisbee and I'm the perinatal mental health midwife at University Hospital Waterford. The role of the mental health midwife includes triage and assessment of women attending maternity services who have been referred due to a mental health issue. I provide care and support for women with mild to moderate mental health issues. I will also work within a referral pathway for women with moderate to severe mental health issues who require rapid specialist interventions from other clinicians within the specialist team. Within the perinatal mental health midwife role, I provide psychotherapy interventions such as cognitive behavioural therapy, motivational interviewing, birth reflections, trauma-focused care, management of PTSD and talk therapy. When you come to see me, you are given the opportunity to discuss any anxieties or concerns that you may have in relation to your mental health in a confidential, private and comfortable environment. This assessment is to allow the practitioner and the client to jointly form any specific care pathways that may be needed to assist, improve or smooth their journey throughout their pregnancy and the postnatal period.
Hi, my name is Lorna. I'm privileged to be part of a team here in University Hospital Waterford that run a postmenopausal bleeding clinic every Wednesday and an abnormal uterine bleeding clinic once a fortnight. The aim of our clinics are to see and treat women, allowing a one-stop approach of gynecological conditions that serves as an alternative to conventional outpatient clinics followed by inpatient surgery. As part of my role, I speak with women before their appointments each week. providing them with an opportunity to ask any questions and help alleviate any concerns they have regarding their appointment. This results in a woman who is well prepared and informed prior to her appointment. Creating this rapport with women has resulted in great feedback when I meet them at their appointment and carry out their procedures. It also provides continuity of care and ensures that they experience a seamless pathway of care. Whilst our clinics are aimed towards caring for postmenopausal bleeding and abnormal uterine bleeding, we also see a variety of other concerns within women's health, including perimenopausal bleeding, HRT-related bleeding and HRT issues, Mirena insertions and removals, women that require thermal ablations, to name a few. Our mission is to create a space for women's health where women are cared for and heard, both holistically and individually. Thank you.
My name is Maria Branach and I work as an advanced nurse practitioner in the neonatal unit. I work alongside the nursing and medical staff in the neonatal unit to ensure that your baby receives the best care possible. I work closely with our maternity colleagues and will come to meet you if you're admitted for an expected early delivery. I attend all preterm deliveries and am involved in the initial management of these infants. My job also involves working on projects to improve feeding and temperature management. I work closely with all of our parents and babies in preparation for discharge home from the neonatal unit and outpatients clinic. We promote family-centred care in the neonatal unit and I look forward to meeting you. One of my projects is called the Warm Bundle, and this involves keeping babies warm throughout their stay, which is very important for their well-being. Initially following delivery, your baby is thoroughly dried and a wool hat is put on before being placed skin to skin. You will be given this wool hat, which has been kindly donated by a local knitting group. You should bring this with you to the hospital along with vests, baby grows, cardigans and at least 2 cellular blankets. We will show you during your stay how to check if your baby is warm enough. We have wall thermometers to alert you when the air temperature is too cold, and we keep the windows closed on the maternity ward to avoid drafts.
Hi and welcome to the neonatal unit in University Hospital Waterford. Here in UHW we take babies from 28 weeks onwards, and so if your baby has to come to us for any reason after birth, they could be here for a few days or for longer. During that time we're part of a dedicated team here of nurses and doctors and physiotherapists, dietitians, lots of other people who will all help you on your journey to get your baby home. We encourage family-centred care here at all times where it's possible. So we encourage parents to visit and we encourage them to participate in baby care.
Hi, my name is Caroline. I'm one of the medical social workers in University Hospital Waterford. The role of the medical social worker at UHW is to provide support to patients attending the hospital. The service's main role is to help women and their families with any psychological, emotional, social or practical difficulties that may arise during pregnancy and after the delivery of the baby. Pregnancy impacts people's lives and their lives impact the pregnancies. Therefore, it is the social worker's role to assist and support people through this transition. A referral can be made by the medical team. Once a referral is received, you will be contacted by a medical social worker to set up an initial assessment. We will arrange to have your appointment coincide with other hospital appointments, where and if possible. If you wish to speak to a medical social worker, please ask your midwife or doctor to make contact with the department on your behalf.
My name is Jill Whelan. I am the bereavement support midwife at University Hospital Waterford. In the majority of cases, pregnancy is a happy and positive time. However, in some rare incidents, women and their partners and families may experience pregnancy loss. Sadly, more than 1 in 5 pregnancies ends in miscarriage. Each year, around 14,000 women will have a miscarriage in Ireland. My role as bereavement support midwife is to provide practical and emotional support to women and their families who are sadly experiencing pregnancy loss. I work alongside the obstetricians, midwives, medical social worker and the chaplaincy service to ensure families receive good quality, compassionate and emotional support, sensitive to their cultural beliefs. Here in University Hospital Waterford, we have an established pregnancy loss clinic for couples experiencing recurrent miscarriage. If you would like to be put in touch with the bereavement support midwife, please ask your midwife or alternatively go to pregnancyandinfantloss.ie.
Hello and welcome to the Admissions and Delivery Unit of University Hospital Waterford Maternity Services. My name is Lorraine and I'm one of the Clinical Midwifery Managers. We are delighted to welcome you to our unit where we strive to provide you and your birthing partner with compassionate, high quality care that meets your individual needs and wishes. Mums and babies are at the heart of everything we do here, so we are confident we can offer you the service you want for you and your baby and your partner. I will now take you on a tour of our unit. We have 2 admissions rooms, 3 fetal assessment beds, 4 birthing rooms, 1 delivery theatre and recovery room. This is our admissions room where we will welcome you and introduce ourselves. You may have already rung ahead and spoken to one of our midwives, and we encourage you to do so, and for all women to ring ahead, as it provides you with reassurance and support, and it allows us to triage our admissions effectively. The monitoring equipment helps us to establish how you and your baby are doing. We monitor your baby for approximately 20 minutes and listen as you tell us why you have come to our unit. Depending on this assessment and your birth preferences, you may require an internal vaginal examination to determine if you are in established labour. If you are in established labour, we will escort you to the birthing room with your partner. If you are not in established labour, we will discuss 2 options with you. You may go home to return at a later time if you are comfortable to do so, and if your pregnancy is low risk. You may go to the antenatal ward until your contractions are more established, and we will continue to support and reassure you. We have 4 birthing rooms. This is our home from home room, but all of our birthing rooms contain similar equipment. We have a woman-centred approach in our unit where you will be very much involved with your birthing partner in the decision-making process. And if we have not already discussed with you your birth preferences, we will do so now. As midwives, we will support and encourage you to listen and to trust your body. We will encourage you to remain as active as possible throughout your birthing journey, and we have many supports to aid and assist you and your partner to achieve this, such as the birthing ball, the peanut ball, the birthing couch, the birthing mats, delivery bed which facilitates different positions, the birthing stool, use of water, the shower and the bathtub, mental relaxation using water, music and mood light, aromatherapy diffuser and hypnobirthing, and adoption of different labouring positions to achieve optimal fetal position, use of TENS, use of Antenatal. We also have a 24-hour epidural service which is available should you request it. You will be assigned a designated midwife who will be with you throughout your birthing journey. And this midwife will be a constant active guide throughout your birth, providing emotional, physical and professional support. And this support will be on your terms, as every labour is unique to each individual. We strive to provide a trusting, supportive relationship in which every woman is seen and heard to achieve the birth that they desire safely. During labour, monitoring of your baby may be intermittent auscultation or continuous monitoring. Continuous monitoring does not mean that you can't move around. This is still possible with some modifications to your range of movement. And if for any reason your birthing journey results in the need for a cesarean section, you will be fully involved with your partner in the decision-making process. Our delivery theatre is located just across from the birthing rooms, and your partner can accompany you on this journey. The second phase, the birthing phase, is mum-led with encouragement and support from your midwife. We will adopt many alternative positions during your birthing phase to facilitate your baby's descent through the birth canal. And these positions include sideline, all fours, upright, semi-recumbent, squatting and the use of our birth stool. The third stage of labour involves delayed cord clamping, and according to your birth preferences it may be physiological or active third stage of management of the placenta. Uninterrupted skin to skin is supported for a minimum of 1 hour, and we will support and initiate breastfeeding when you are ready. And finally, we thank you and your partner for allowing us to be present at this important moment in your lives, and we wish you happiness on this special journey.
My name is Iselle. I'm the maternity dietitian in UHW. I work as part of the multidisciplinary team to help mothers manage certain medical conditions in pregnancy, such as malnutrition, malabsorption, weight management, diabetes, hyperemesis, anemia, and hypertension. Face-to-face consultations are conducted on Monday afternoons and Friday mornings. The clinics are usually booked within a month from receiving the referrals. A letter will be sent out to you with a date and a time of your appointment. All newly diagnosed gestational diabetes mothers are seen in the virtual clinic along with the diabetes midwife within a week of diagnosis. Individual consultations are arranged during the multidisciplinary diabetes clinic where additional input is needed. A gestational diabetes cookbook is given to all patients in our diabetes services. Your baby's taste buds start developing around 9 weeks of pregnancy. This enables your baby to start tasting the amniotic fluid in utero, which is influenced by what you eat. What you eat has a big influence on your baby's physical development, taste development, and future health.
Hi, my name is Colette and I'm a neonatal nurse here in University Hospital Waterford. Kangaroo care is the practice of holding an infant dressed only in a hat and nappy so that the frontal contact of parent and infant is skin to skin. If your infant is well after birth, they will be dried and placed on your skin wearing only a hat and nappy. It is important to cover the baby's head as this large wet surface will be the greatest source of heat loss. Make sure the room is warm and draft free. Close windows and doors and cover the infant with a warm blanket. Keep the head in the sniffing position, chin slightly raised with nose up and the baby's body touching your skin as much as possible. Your skin will heat up if the baby is cold and will cool down if the baby is too warm. This is known as maternal-infant thermal synchrony. Kangaroo care should be provided for at least 1 hour after delivery if possible. This allows the baby to reap the rewards of this basic stress-relieving standard of care. It is scientifically proven to increase the amounts of oxytocin, which is a good hormone, in the baby's central nervous system and decreases the cortisol, which is the stress hormone that the baby may be harbouring post-delivery. If you plan to breastfeed, the contact with your infant in this first hour will positively influence the hormones your body needs to produce milk. If your infant is well, your infant should also be more relaxed and willing to latch on and feed well. If you do not intend to breastfeed, it is still recommended that your infant is held in kangaroo care for up to an hour a day and more if possible, as they will also reap the rewards the contact will provide. Kangaroo care helps to keep your infant warm. It helps them to relax into a deep sleep more quickly and will sustain it for longer. Benefits of kangaroo care also include psychological wellness, improving outcomes for infants as they develop and reach their milestones. The benefits of kangaroo care for the preterm infant are amazing and will positively affect the infant's stress levels, their weight gain, their infection risk, their heart rate, breathing rate and overall well-being. If you are expressing breast milk or breastfeeding your preterm infant, kangaroo care will also positively affect the hormones you need to increase and maintain your milk supply, especially when separated from your baby. Kangaroo care is recognised all around the world as one of the best primary standards of care for infants, whether they are well, unwell, term or preterm. Make sure you ask your healthcare professional to assist you to provide it as much as possible.
Hi, my name is Anne. I'm the Diabetes Midwife Specialist in University Hospital Waterford. My role as a midwife specialist is to provide care for women whose pregnancies are complicated by diabetes. I manage and monitor all type 1 and type 2 diabetes and all mothers who develop gestational diabetes in their pregnancy and until their delivery with the multidisciplinary team. All of my patients will be offered virtual diabetes clinics with me every week, where readings are uploaded and all aspects of care delivered. Feedback for this has been very positive, and it allows women freedom to attend clinics from home or work or wherever they may be. All women who attend University Hospital Waterford for their antenatal care are screened for the risk of developing gestational diabetes. The screening process occurs at your initial booking visit, whereby if risk factors are identified, an appointment is made for diagnostic blood tests known as a glucose tolerance test. If the risk factor identified is a previous history of gestational diabetes, a glucose tolerance test is offered at 16 weeks. If negative, in this instance, the test is repeated again in 28 weeks. All other risk factors require a glucose tolerance test to be completed between 24 and 28 weeks gestation. Approximately 15% of women screened for gestational diabetes test will test positive. You will get a phone call with your results, and your pathway of care will be discussed with you, and a plan will be put in place to arrange monitoring of your blood glucose levels, your diet and lifestyle. Pregnancies complicated by diabetes are deemed high risk and require closer monitoring within the clinic. The Gestational Diabetes Clinic enables regular review by the consultant endocrinologist and the consultant obstetrician up until the delivery of your baby.
Gestational diabetes is one of the most common health problems that can happen during pregnancy. It affects as many as 12% of pregnancies in Ireland and can lead to serious problems for both mum and baby. Certain women are at higher risk of developing gestational diabetes. For example, if you are overweight, if you have a family member with diabetes, if you had gestational diabetes in a previous pregnancy, or depending on your ethnic background. If you are at risk, you will receive a blood test for gestational diabetes between 24 and 28 weeks of pregnancy. If you are diagnosed, there are day-to-day changes you can make to stay healthy. How much exercise you get and what kind of food you eat can have important effects on your health and your baby's health. But what happens when you have gestational diabetes, and how can diet and exercise help? Food and drinks are broken down in your digestive system. The sugar they contain is absorbed into your bloodstream. But sugar needs insulin to work. Insulin is made by the pancreas and helps sugar get into your cells. Insulin acts like a key that lets the sugar move from the bloodstream into the cells of your body, where it is used for energy. Pregnancy hormones change the way insulin works in your body. In the later stages of pregnancy, these changes make it difficult for insulin to unlock the cells and allow the sugar to enter. This is what is known as insulin resistance. Some insulin resistance is normal in pregnancy, but this means that your pancreas needs to work extra hard to keep blood sugar levels in a healthy range. When you have gestational diabetes, your pancreas is not able to keep up. As a result, too much sugar is left in the blood. However, a carefully planned diet with high-fibre carbohydrates and no added sugar can make it easier for your body to manage the sugar in your blood. Exercise will also help keep blood sugar low, as it improves insulin's ability to unlock the cells and uses up sugar for energy. If blood sugar is controlled, your chances of a healthy pregnancy are the same as a non-diabetic mum. This makes diet and exercise powerful tools for a healthy pregnancy. However, if blood sugar is not well controlled, this can lead to problems in both mum and baby. In a study of 23,000 pregnant women around the world, researchers found a link between high blood sugar in mum and babies that had grown too big. Researchers also found a link between high blood sugar and preeclampsia, premature delivery, need for caesarean section, birth injury, and abnormal sugar control in baby. Diabetes during pregnancy can also put you and your baby at risk for problems later in life, including type 2 diabetes and heart disease. But there are actions you can take. Changes in diet and exercise, combined with close monitoring, can successfully manage blood sugar in 7 out of 10 pregnancies. So no better time to start than now. To learn more about Irish research on maternal and newborn health, you can visit the HRB Mother and Baby Clinical Trial Network's website.
Hi, my name is Julianne and I'm one of the women's health physiotherapists here at University Hospital Waterford. Pregnancy-related pelvic girdle pain refers to pain that can be felt in one or both buttocks or around the pubic bone at the front of the pelvis. Women will describe it like a sharp stabbing pain in the bum or as if they've been kicked right in the centre of the pubic bone. Pelvic girdle pain can be a significant cause of disability and discomfort. The common signs of pelvic girdle pain are pain or discomfort with turning in bed, going from sitting to standing, getting out of a car, walking, pushing heavy objects like a shopping trolley or a hoover, walking upstairs. Your pelvis is a very strong, stable structure and it remains robust throughout pregnancy. But in pelvic girdle pain, the muscles and tissues surrounding the pelvis become sensitised, which generates protective responses and tension develops. This is felt as tightness by the pregnant woman and can cause movement to be sore or painful. So, how do you manage it? You can manage pelvic girdle pain through understanding your pain, improving your emotional well-being, sleep optimization, regular exercise, and external supports such as belts or manual therapies can also be used when needed. The following are simple day-to-day measures which may also help. Stay active and also get plenty of rest. Get to bed early and avoid screens for an hour before bed. Practice abdominal breathing before sleep to calm down the nervous system. Avoid activities that make the pain worse or modify them to make them easier. Change your position regularly. Try not to sit for more than 30 minutes at a time, and if standing, sit down and take a few breaks. Wear supportive shoes, avoid high heels, and stand with equal weight through both feet. Sit down to get dressed and undressed. Avoid crossing your legs while sitting or standing. And ask for help with household tasks. Break them down into smaller loads and take regular breaks. A hot pack can be very soothing for low back or buttock pain. Ice packs can be helpful if your pain is around the pubic joint at the front of the pelvis. Use it for 15 minutes a few times a day. We never put ice directly on the skin, but wrap it in a towel before applying it to the area. Obviously, heat or ice can burn, so be sensible using these modalities and never fall asleep with either heat or ice on. I'm now going to demonstrate a few exercises which can be helpful. If an exercise is too difficult or painful to do, leave it out and come back to it another time. Pelvic tilting. Sitting up tall on a gym ball or a chair, we tilt our pelvis forwards and then roll back on our sit bones. We breathe in to come forwards and breathe out to roll back. If using a gym ball, make sure it's made from anti-burst material, which means it will slowly deflate if punctured. Piriformis stretch. In a seated position, bring one ankle to the opposite knee. We are aiming to feel a comfortable stretch in the buttock area. We may need to lean forwards to feel the stretch. Breathe normally and repeat on the opposite side. Child's pose. Start in a hands and knees position. Sit back onto your heels and stretch your arms forwards. Focus on relaxed breathing throughout. Cat stretch. Again on hands and knees, arch your back up towards the ceiling as far as is comfortable, keeping the neck and shoulders relaxed, breathing throughout. Then return to a neutral, flat back position. Pelvic pain can be fluctuating in nature, and an important factor is self-compassion. We often need to slow down and ask for help for our needs to be met at this time. If you are experiencing pregnancy-related pelvic girdle pain, please reach out to your medical provider. It may be appropriate for you to come for a physiotherapy assessment. We would be happy to help.
Sinead Thompson and I'm a community midwife at the National Maternity Hospital. I designed and created labour hopscotch in 2015 in response to an increase in the epidural rates and also in medical interventions during labour and birth. The principle of labour hopscotch is to encourage optimal fetal positioning. This means having your baby's head in the optimum position, lined up so it can descend into the pelvis in the optimum position for labour. When this happens, it triggers the spontaneous onset of labour. When women go into spontaneous labour, it's less likely that they'll need induction, and that means that there'll hopefully be less intervention in their births. The labour hopscotch framework aims to support and promote natural and active labour. It is encouraged for all women, regardless of the care pathway that they choose for their birth, but encourages more natural methods of pain relief where possible, for as long as possible in labour. Using the idea of the game hopscotch we all played years ago, each of the steps can be undertaken to remain active during labour. The process can start at home, beginning at the bottom of the hopscotch board when you're more active and mobile. The bottom square of the labour hopscotch is called the mobilised square, and it aims at promoting optimal fetal position. There are 4 activities associated with this step, and it's important that these 4 positions are practiced throughout the antenatal period in preparation for your labour. Your midwife will explain the positions to you during your pregnancy. Our research findings, which we published in 2019 in our research study, showed that women who practiced labour hopscotch had reduced epidural rates, reduced the caesarean section rates, increased spontaneous onset of labour and vaginal deliveries, and most of all, there was an increase in birth satisfaction rates. Having a positive birthing experience makes a smoother transition to parenthood.